ladies and gentlemen, and welcome to the latest in the series of public lectures from Lancaster University. I'm Professor Angus Lang. I'm Dean of Lancaster University Management School, and I'm genuinely delighted to be hosting tonight's public lecture. And I would like to extend a very, very warm welcome to you all. I think we all recognize, we all feel that the last year has been extremely trying. It's been extremely challenging for our communities, both regionally and further afield. Tonight's lecture is the sixth in this academic year's series. And it is, as I said, my pleasure to welcome you as we continue to explore the challenges, but also I think we should recognize the opportunities brought to us by the pandemic. Our public lecture series is a very important part of the university's engagement with its communities. We aim to host lectures that are meaningful and relevant to our audiences, but above all, interesting. And I'm confident tonight that we have a panel that will make sure that they are interesting, but equally relevant and meaningful to you. So tonight, the panel we have joining us is Dr. Sherry Kothari, who is a director of Lancaster's Health Innovation Campus, Annette Weekes, who is the managing director of PDS CNC Engineering, Professor Stefanos Mouzas, who's Professor of Marketing and Strategy in the Management School at Lancaster, Matt Hutchinson, who's Senior Business Project Manager in the Management School, and Dr. Catherine Porter, who's a Senior Lecturer in Economics, also in the Management School. Now, all tonight's topics are grouped around the theme, are clustered around the theme of resilience, resilience at work, resilience in life, and how we can work together as a community to find the most effective ways forward in these uncertain times. Now, before I go into saying a little bit about what our speakers will talk about, I think it's worthwhile just highlighting a little bit of background on our speakers. So Sherry Kothari, who is the director of the Health Innovation Campus. The Health Innovation Campus brings together businesses, communities, healthcare providers, and researchers to try and address the significant challenges that we face around health in the northwest of England, the health and social inequalities that are a sad hallmark of this region. And Sherry and her colleagues in the Health Innovation Campus are part of the COVID-19 manufacturing cluster for Lancashire and South Cumbria, and have been active in supporting the NHS throughout the pandemic. I'd like to welcome our external speaker tonight, Annette Weekes. Annette, as I mentioned already, is the Managing Director of PDS CNC Engineering based in Nelson. She is the co-chair of the COVID-19 Manufacturing Cluster for Lancashire and South Cumbria, a group which she founded with a number of partners, including Lancaster University, the University of Central Lancashire, and Cube Thinking, very much as a response to the overwhelming demand and need from the NHS to cope with the challenges posed by the pandemic. Next up in terms of our speakers is Professor Stefanos Mouzas. Stefanos is Professor of Marketing and Strategy at Lancaster University Management School. His work includes a range of collaborative research projects with manufacturers, retailers, financial institutions, and technology companies. And during the pandemic, Stefanos has worked with the LUMS Recovery Programme to deliver a bespoke programme on enhancing business resilience for SMEs. We'll hear more about that in due course. Speaking alongside Stefanos is Matt Hutchinson, who is one of our senior business project managers within the management school. He oversees the delivery of a portfolio of knowledge exchange and business engagement activities covering areas such as business growth, innovation and leadership. And specifically, LUMS led the development of the aforementioned SME focused response program for the COVID-19 pandemic. And last, but by certainly no means least, is Dr. Catherine Porter. Catherine is a development economist and a senior lecturer in the management school, while at the same time also being the senior quantitative advisor to the Young Lives at Work project. Her research interests are in the areas of applied microeconomics, most particularly in how risk affects the lives of the poor, the impact of unexpected events on various outcomes, such as nutrition, schooling, and parental investments. So I'm sure you'll agree, we have a panel with very, very considerable expertise. Now, during the lecture, our presenters are going to be exploring how the resilience of young people in low and middle income countries, as well as locally within the northwest of England. Then we will look at discuss how the Health Innovation Campus has effectively served as a catalyst within the region for bringing together a range of essential suppliers. And last, how the management school has supported a broad range of enterprises across Lancashire and Cumbria through these difficult times. So I think we will be having a interesting, stimulating session. And without further ado, I'm going to pass over to Sherry Kothari and Annette Weekes to launch this public lecture. Thank you very much, and over to Sherry.
Thank you. I'm Sherry Kothari. The Health Innovation Campus is a £41 million flagship initiative at Lancaster University, supported by the Local Enterprise Partnership and the European Research Development Fund. Our vision is to be a catalyst for change in the region, really to help improve healthcare outcomes and foster economic growth. But what do I mean by that, and where is the innovation in this? So consider the following. Over 80% of the factors that determine our health and well-being are non-medical. These are the general socioeconomic, cultural, and environmental conditions we live in. Factors such as housing and water and sanitation, access to parks and recreation, access to healthcare, factors such as levels of education, skills and training, whether we are employed or not, what our working conditions might be like, our levels of income, and things like job security. Another factor very topical at the moment around food systems, agriculture, food production, access to affordable, healthy food. And of course, as we all know only too well now, the importance of having social and community networks. All of these factors are further amplified by our individual lifestyle choices, such as smoking, drinking, levels of exercise, our diet, and then, of course, our behaviours and attitudes. And these are the so-called wider determinants of health. And yet, as a nation, we spend almost 90% of our healthcare budget on treating illness. So startlingly little is spent on upstream prevention. So here at the Health Innovation Campus, quite simply, we want to help shift the focus from treatment of illness to prevention and living well, because good health is and should be our collective responsibility. But of course, this isn't trivial. And so in order to bring about this shift, we need to understand the impact of these wider determinants and then address the associated big societal challenges that they present. And we can only truly do this by bringing together and working with all the different stakeholders and agencies that might influence these factors and the outcomes. So not just health and social care providers, but local and national government, businesses, charities, communities. So how does a health innovation campus at a university help do this? Well, when we think about health and well-being, the traditional approach has been to focus on specific diseases or conditions. And what one often tends to find in many higher education institutions that have this sort of initiative is that this would generally be housed within a department of medicine or within a medical school. At Lancaster, however, the Health Innovation Campus sits alongside faculties and works closely with all disciplines. And in fact, I'm proud to say that we have some aspect of health research in every faculty and department across the university. And this allows us to leverage expertise from those disciplines not traditionally engaged in health. And this is really important if we are to address the wider determinants of health. And Lancaster University, as an anchor institution in the region, is therefore ideally positioned to adopt a genuine multidisciplinary, multi-sectoral approach. This also has the added advantage of bringing different skills to the table. So through bringing different stakeholders together externally, but bringing different disciplines together internally, we bring a whole set of different skills and different perspectives. And the idea here is to really listen to some of our stakeholders so that we better understand the problems that we face, and then work closely, leveraging on expertise and experience that all our stakeholders bring to co-develop and co-design solutions. And I cannot stress enough the importance of doing this, because that's how we make sure that the solutions we design are actually workable. They've got buy-in, they're practical, and they can be sustained in the long term. I mean, all too often we know where sometimes you start a project that has got some funding for 2 years. Once the funding disappears, we don't have a way of continuing some of the good work. So we need to find things that will sustain. And to give you some examples, this is a photo of a unique automated social distancing and wayfinding system at the Health Innovation Campus. Developed by colleagues in our School of Architecture, it's an excellent example of a public health solution provided through the lens of a non-medical discipline. This is innovation. The system, developed through algorithms, is able to respond to changes in government advice in relation to social distancing and can be rapidly adapted to conform to different rules as they change. It also provides the potential to evaluate how people might respond to different types of signage over time. And this is again very important, especially given that social distancing could be with us for some time yet. Our excellent relationships with local GPs and hospital trusts, the voluntary sector, charities and local communities provide us with many opportunities to contribute to interesting and important projects, of which this is another example. And this is also another example of how we can actually look at things a bit differently. Healthier Fleetwood, started by a local GP, Dr. Mark Spencer, is a partnership of residents, healthcare providers, charities, and other groups. Driven by the interests and priorities of the community in Fleetwood, this partnership offers people the chance to empower themselves and start making positive decisions about their health. Lancaster University is now involved in this initiative, and drawing in experts from across the university, we are involved in 4 of their work streams, as diverse as exploring the use of data to assessing the impacts of the pandemic and looking at the importance of employment opportunities for different age groups. These are both examples of how taking a different approach or bringing a different perspective to a problem can lead to potential reduction in illness, or I should say an uplift in wellness, and reduce costs and the burden on the health system and shift the emphasis on being healthy. Building on Lancaster's successful business engagement programs, which you will hear more about in the next talk with Stefanos and Matt, we have access to a wide network of innovative SMEs. In fact, throughout last year, we have continued to run our fully funded business support programme that has supported more than 150 Lancashire SMEs looking to innovate in health. And we've had to rapidly pivot to address their needs, especially in this last year, around resilience, leadership, diversification, and workplace well-being. And we've just started this year focusing on food innovation and design thinking, all in an effort to help businesses survive and build resilience. The impromptu establishment of a COVID-19 manufacturing cluster during the PPE crisis early on in the pandemic is a testament to the success of some of these business programs. Triggered initially by the ventilator challenge, we had businesses getting in touch with us, offering their support in any way they could. These businesses were spurred on by wanting to simply help at a time of national crisis. And one of the reasons for getting in touch with us was they could not actually get any response from the NHS, understandably. And with the situation changing daily, sometimes hourly, people were desperate to help. We therefore leveraged on our relationships with local NHS partners and became a single point of contact for their procurement teams to help channel inquiries from businesses and direct support where it was most needed. And so the COVID cluster was born. Now, one of the companies that responded very quickly to calls for help was PDS Engineering. And you are going to hear from Annette shortly. Annette was very keen to help and had the capability and capacity to do so. She was instrumental in supporting the effort, and working closely together, we set up a database of businesses in the region almost overnight, documenting the companies, the skills and expertise they could offer, their capacity to scale up manufacturing, their track record in making medical devices, what their supply chains might look like. And it was through this that we developed what proved to be an incredibly helpful resource during the PPE crisis. And in some small way, I'd like to think we helped support our local NHS partners when they most needed it. SMEs are the lifeblood of the economy. And so the challenge we have now is to make sure that we harness this significant asset going forwards. And whilst we continue to support many of these businesses, the key thing is that in this cluster, we have some capabilities and capacity in the region that we should harness. So I'm going to now hand over to Annette, who's going to tell you a bit more about the cluster and where we would like to go from here, some of the ideas we have in terms of supporting these businesses in a way that helps to revitalise and future-proof our region. So Annette, over to you.
That's great. Thank you for that introduction, Sherry. So I'm Annette Weekes. I'm Managing Director of a small group of SME engineering companies. I'm also a Director of the LEP, the Local Economic Partnership for Lancashire, and the Chamber of Commerce. I'm Chair of the LEP's Manufacturing Strategy Group and sit on the Health Strategy Group. So I've got quite a strong interest in health and health in our region in particular. Just a little bit of background into who we are. So PDS Engineering is a precision engineering company. As when we were introduced, as was said, we're located in Nelson, literally on the cobbles in Nelson, but excellent at what we do. So we're renowned for working on land speed record attempts, such as the thrust supersonic car. We rebuilt Donald Campbell's Bluebird boat when it was recovered from Coniston. We make parts for people like the Imperial War Museum, Rolls-Royce engines, Formula One, you name it, we've probably done it. So we're fast, we're flexible, and we enjoy providing solutions, which I think that sort of inbuilds resilience right the way through the company, which I think is what made us a good partner for Sherry and her team with the COVID crisis. So when lockdown first happened and the government decided manufacturing would keep going, and our customer base has decided that too. So many manufacturers stayed active and were unable to close even in the initial lockdown. And there was a great deal of difficulty around that, both in terms of protecting staff, but also in terms of failing order books. So many manufacturers across many different sectors suddenly saw huge impacts in terms of the work that was required for them to do. And as traditional workloads disappeared, they did what they do best. They collaborated, They applied a passion for problem solving to new areas. So whether that was around ventilators or hospital equipment, fittings and fixtures for the Nightingales, mortuary equipment, food manufacturing, food delivery, automation, our local manufacturing base pivoted and restructured and aligned themselves to apply what they knew best to new areas. It was just an absolute joy to see the collaboration, the shared work, competitors becoming close and genuinely friendly as people looked after their staff, the people, their supply chain and their customer base. So Sherry and I first met initially over Zoom calls around the ventilator manufacturing crisis and general NHS shortages. They were rapidly arranged sessions looking to tackle the fast-moving COVID crisis with even faster solutions and quick results required. And as the NHS requirement built, manufacturers came forward to offer support, but it was essential to streamline the process. And by forming a group, we discovered we could speed communication and act as a single point of hub for the NHS through the work of the Health Innovation Campus. So the local manufacturing base was keen to support the fight against COVID where they could, and a lot of them had capacity available because of a downturn in their existing workload. So by working together, we managed to harness the manufacturing companies to fill some of the gaps. So these were companies working in other areas on other products, which pivoted and redeployed to meet the NHS needs. So whether that was around plastic 3D printed visors, ventilator parts, hospital gowns, we formed a cluster of some 80 companies, and we filled those NHS gaps and supported those manufacturers as well. The breadth of this group is absolutely massive. From textiles and seamstresses to electronics and aerospace, we encompass a huge variety of businesses serving a multitude of sectors. As Sherry said, and Sherry's reference was overnight, but actually it was over a weekend. In one weekend, we created from scratch a web presence, a membership database and a marketing campaign to harness that manufacturing base and set to. The cluster was born and manufacturers were supporting the NHS and keeping their own staff in work within weeks. We were fast and flexible, and we reached out for support, collaborated with the Chambers, Lancashire Business Review and Regional Press, and a myriad of helpers from graphic design to people writing press releases for us, endless Zooms, chasing phones. It was all done just over a weekend. And working collaboratively with Sherry and her team, we were able to link up manufacturers with the NHS requirements. So companies previously specialising in, say, stage and theatre curtains, now manufacturing hospital scrubs, aerospace composite manufacturers producing filters for ventilators and masks, anyone in the area with a 3D printer making visors, gym equipment manufacturers designing hospital beds for the Nightingales, the list goes on and on. It was the ultimate demonstration of resilience and collaboration and of coming together for a greater good. 12 months on, the group is still active. We've been able to signpost members to business opportunities and to COVID support. We've worked closely with the Chamber in terms of reaching out to the membership to promote peer-to-peer networking and other initiatives. And the speed of which these businesses pivoted was impressive. The experiences we had in forming and running this group, as well as the stories that these businesses tell, is feeding into work being done by the LEP and others now. So we look to ensure that we can share the best practice and continue in a spirit of collaboration and resilience going forward. And let's hopefully learn the lessons of COVID into a post-COVID era. So thank you for the opportunity to speak to you today. I'd like to hand over to Matt Hutchinson initially.
Annette, many, many thanks. Sherry, many, many thanks. And next up we have Stefanos Mouzas and Matt Hutchinson, with Matt going first. Matt, over to you.
Thanks, Angus. I think just while I start talking, Stefanos is going to put some slides up for us. Before I delve straight into what we did in the management school in response to COVID, just want to give a little bit of background and context onto the work that we do with SMEs. So we've been working in the SME space since 1999, focused on particularly entrepreneurial learning and developing the business processes and practices of firms, particularly in the Northwest. And what I'm talking about within this is really knowledge exchange. So not particularly accredited learning or executive education, but about the firms and the practices specifically. Cover a number of themes within that around leadership and innovation, that kind of area. And we work in particular verticals as well, so like family business and manufacturing, food and drink. The way we do that is that we draw on the academic research and the deep expertise that we've got in those relevant areas. Today's example, and the reason that Professor Stefanos Mouzas is here with me today, is around enhancing the resilience of firms. We combine that deep expertise with industry insights and best practice from people who've got the t-shirt from having been there and done it. And we create what we call transformational intervention through delivering in a deep trust peer network, so putting business leaders with other business leaders to learn from each other as well as from us. And the output of that is that it's a facilitated learning journey, and each delegate that goes through that process has a different experience and different outcomes. And that's a very similar model to what Sherry was talking about being delivered through the Health Innovation Campus. So when COVID struck, through all that work that we were doing, we had a lot of relationships with small businesses across the Northwest. We were hearing a lot about what they were facing. Initially, all of that was really quite operational and short-term priorities. So how do we furlough our staff? How do we get our heads around remote working and get our team set up for it? Where does the money come from to pay the bills? Things like that. But after a while, everybody started to realize actually this was a slightly longer game. We need to lift our heads up, start looking outwards, forwards, start thinking more strategically. And that's really where we saw our role. That's about mindset and business practices and strategic thinking. And so from that, the COVID-19 response program, Recovery and Resilience for SMEs, was born. We created that through forming a group of academic colleagues to help design and create and deliver that program. And that group obviously included Stefanos, who's going to talk in a moment. But really importantly, that wasn't just about helping those businesses recover from the impacts of COVID, but it was about building their resilience for any future adversities that may come along. So it was 5 half-day digital workshops around understanding the new normal, identifying strategic options and what innovation opportunities there were, and particularly how to lead that change through in a really difficult time. We delivered that to 26 SMEs across Lancashire and Cumbria in a really short space of time across the summer of 2020. And normally to quantify the impact of the work we do, we look at economic success measures, so things like GVA, revenue increase, jobs created, things like that. But they take quite a while to create, and it's not necessarily the economic climate. So you can see on that slide there some of the feedback that we got from the businesses who took part in that session. So people taking different things from it, like I say. So David Hammond of ChipTech, who radically changed his business model and the whole direction of his business as a result of the program. Jackie and Ruth, who really both drew on the academic expertise, and particularly Stefanos, who's going to talk in a moment. Alongside that, we commissioned an independent evaluation into the work that we'd done to add a bit more flesh to that bones. And these are the key themes that really came through from those first 26 businesses that we worked with. So about sharing that experience with a community of similar people, about developing their flexibility and creativity, and about the opportunity to develop new things and look at their strengths and really build through that. So it was really positive overall feedback from what we did in the first instance in response to the pandemic. But as everybody here will know, the world was moving faster than ever before, and things were changing so quickly at this time during the pandemic. So we needed to revise a little bit of what we were delivering, particularly how we packaged it and put it out to businesses. So after that, we adapted the program into what we called the Business Model Innovation Program, which really focused in on the opportunities for businesses to adapt their ways of working at a really fundamental and a business model level. So not just looking at product and service innovation, but really new ways of creating, delivering and capturing value for existing and new customer segments. We delivered that to an additional 47 SMEs, so that's 73 across the two programs. And Kate's testimonial there just shows the elements that I was talking about that go into our programs, that facilitated learning and really time to work on the business and sharing that knowledge both with us as academic expertise and from other business leaders. At that point, I'm just going to hand over to Stefanos, who's worked with all 73 of those businesses through the pandemic. And his input on that of the rest of the delivery team has really helped those businesses, as I say, not just recover from the impact, but also to build their resilience for the future. And Stefanos is going to share some of the insights that he's gained through his research and his engagement with these businesses through this program. So Stefanos, over to you.
So you might ask the question, what is the lesson that we have learned from the COVID-19 pandemic? And the lesson that the COVID-19 pandemic has taught us is twofold. First, companies need to put much bigger buffer of resources aside, and they need to develop much higher flexibility to adapt to evolving customer needs. And the reason why we gained this lesson is that adversities such as the pandemic, but also natural catastrophes, economic crisis, geopolitical tensions, or other discontinuities in supply or demand may occur. And companies might try to predict these adversities, but adversities have a major effect on the capacity of the companies to meet their commitments and stakeholders, for example, investors, banks, customers, suppliers, or the employees. Companies might try to predict these adversities, such as the pandemic, but there is a difference between uncertainty and risk. Uncertainty is rather a faceless topology, and companies cannot easily assign probabilities to unknown events. But what companies can do is to enhance their ability to withstand adversities and bounce back. They can enhance their business resilience. Let's look at the two determinants of business resilience, and these are the areas where we gain most of our insights. The first determinant is the resources that the companies put aside, and here two parts of resources, two art of resources are important: redundant resources and liquid resources, but increasingly also intangibles. And the second is the flexibility that the companies develop to adapt and reconfigure their own resources. With these two determinants, companies can withstand adversities and address evolving customer needs. If you look at the resources such as redundant or liquid resources, here we talk about cash liquidity, safety stocks, IT backup, talents, staff, or intangible assets such as partnerships, reputations, skills. And research evidence shows that firms that are exposed to high levels of debt in relation to their equity have very limited flexibility to adapt. They're usually vulnerable and they often fail to survive. Look, for example, at the UK retail bankruptcies over the last 10 years. Companies such as BHS, Thomas Cook, Comet, Poundworld, Blockbuster, Debenhams, and more recently, Laura Ashley, they have all disappeared. And with them, many jobs were lost. The other determinant of business resilience is the ability to adjust to the competitive field and the ability to reconfigure and mobilize resources to address customer needs. During the COVID-19 pandemic, distillers such as Pernod Ricard, Brewdog, Vernon Spirits, or Leith Jeans were able to use their cash liquidity to transform their production capacity in order to supply hand sanitizers. What we try to bring in our engagement with SMEs is a good news. The good news is that demand for goods and services will not stop. Existing and latent customer needs will simply evolve. So it's up to the companies to catch up with evolving customer needs. And with this good news, we are planning ahead. And Matt will tell you a few words about the next steps in our endeavors to engage with SMEs.
So obviously from that, there's huge lessons to learn from the way that SMEs have adapted, responded to the pandemic and from the impacts that the pandemic had. And it's all still ongoing, so those effects are going to last for a little while longer. And of course, there are future adversities to endure for all businesses. So what we're doing in that space now is we're adapting our program even further. And we're focusing on a theme now of responsible recovery. So this is based around the concept that to be viable in the future, organizations need to be responsible not just to their employees and their customers, but also to their society and to the planet, and that they're the metrics that consumers and customers are really starting to measure companies on. And so if we're now building back in that whatever way that may be, so obviously not all businesses have been knocked down, but many have, but the economy as a whole has been severely affected. As we're building back as individual businesses and an economy, build back right, build back in a responsible way. So we're really looking forward to measuring the impact of the work that we've done so far throughout this year, and then the impact of this later stage work that I've just mentioned into next year, and to see how those lessons are learned and how businesses take that resilience story forward for themselves. And with that, I'll hand back over to Angus. Thank you.
Stefanos, thank you very much for taking us through the work that faculty have been undertaking in the context of COVID. Can we now turn to our third and final speaker, and that is Catherine Porter, who will bring a different perspective looking at individual resilience in a rather different context. So Catherine, over to you.
Thanks very much, Angus, and thanks to everyone for still being here. So yeah, a little bit different, change of focus here. I'm going to be speaking a lot more globally, so going from the local to the global, and I'd like to talk about developing countries or low and middle income countries, and a project that I've been involved with for just over 12 years, I think now. And we've been following young people in 4 developing countries. And last year we've done a survey, a telephone survey, to see how the COVID pandemic has affected young people in those countries. So yeah, the summary is that I'll introduce you to the project, which is the Young Lives survey that I've been involved with. And then I'll give you some findings around education, work or labour, and mental health of young people. And then I'll offer a couple of recommendations for policy on that. So the study itself is in 4 countries, going from left to right around this map of the world. We're in Peru, in Ethiopia, in one state of India, and in Vietnam. And there are 12,000 children were followed from the year 2001. So sometimes it's called Children of the Millennium as well. The UK has a cohort survey just like it. And this one began in these 4 countries to get a diversity across the globe, but also to focus on young people growing up in poverty at the turn of the millennium. So here, you can see the structure of the survey. So starting at the left here, we can see that we have a younger cohort who are aged 1, so they are the children of the millennium. And then we have an older cohort who are aged 8 at the beginning of the survey, and they can be used as a comparison group to look at the differences over time. So we visited all these kids and talked to them and their families several times, 5 times in person. And then in 2020, we were planning to go in person as well. I went to Peru and Ethiopia in early 2020. We piloted the survey and then, well, global pandemic hit. So we had to quickly convert to a telephone survey, which is not as easy as you might think when a lot of them didn't even have phones. So we had to get a bit creative about that, sending a local guide with a phone to pass it in a socially distanced way to some of the kids. So a little bit just to show you what we asked about in the survey in 2020. We made actually 3 phone calls. The first call was just to get in touch and hear a little bit about how things were going, ask people what they knew about this new virus, the coronavirus. Even when we're designing the questions, we didn't really know everything about, were you washing your hands? Were you maintaining a distance? That kind of thing. We also checked whether their school was open or their university, whether they tested positive or had a test, or anyone in their family. And we asked about whether there'd been any adverse effects at that point in June 2020. The second call is the main call. Again, we asked about COVID and economic shocks. And then we added more about education and how young people spend their time, employment, earnings, and mental health in the form of anxiety and depression questions. Finally, a follow-up call towards the end of the year, checking again what had happened on education, food security, employment, and mental health. So these are young people who were aged about 19 and about 26. And the concerns of young people in these countries are a little bit different from those that we've got in the UK. There are a lot of similarities. Young people are concerned about lockdowns, about not being able to get about and see their friends. They're also concerned about feeling isolated, mental health, nervous about family getting the virus. On the other hand, I think some of the bigger differences, I think a lot of people with teenagers have complained that their kids are spending too much time on a screen, whereas in Ethiopia, almost none of our sample have access to a smartphone, for example. So it was more an isolation and being really stuck without access to any kind of educational resources. There were some TV and radio shows that they could get involved with, but most of them couldn't get online to learn. So a little bit different, I think, and of course the big contextual difference is really extreme poverty for a lot of them, and a lot of them had to work to try and help their families. So just to give you a little bit of a background on the countries before COVID and what happened during COVID, all four of them actually experienced quite a lot of growth in the 20 years since we started following them. So from 2000 up to 2020, they did have a relatively high rate of economic growth, and we saw a lot of poverty reduction, including in our sample. And at the time of the beginning of the pandemic, Peru is classified as a middle-income country. India and Vietnam are lower middle-income countries, and Ethiopia is the poorest country and one of the poorest in the world still. And here I just wanted to show you the confirmed COVID cases per population. You can see the green line is Peru, and it's really the outlier here. Peru has had a terrible experience with COVID-19. They've had absolutely tons of cases. Whereas when you look at Vietnam, you can hardly see the difference on this graph between Vietnam and the bottom of the scale. Vietnam has had 35 deaths over the entire pandemic. So it's absolutely the other end of the spectrum. And I've put the UK as a comparison there. And actually, so our survey ended just before Christmas. If you keep going until April, you do see that the UK had a much bigger peak than Peru. And now, unfortunately, in April, the UK, as we know, is improving, but Peru is going up again. So we're still very concerned about Peru. And we can see it here when we look at how we've tracked the kids over time. This chart on the right shows the proportion of families who reported a food shortage over time. So when the kids were 12 in Ethiopia, for example, 5% or 1 in 20 had experienced a food shortage, and that didn't change much at age 15. And then it suddenly went up to 1 in 6 households. The pattern's quite similar in India, a really huge increase in, that's people saying that they actually ran out of food one day and couldn't eat anything during that day. So it's quite impressive, the way that things have really been affected. And this has been mirrored in their own self-reported well-being. We asked them on a ladder, on a scale of 1 to 10, if this was a ladder, how do you report how you feel, with 1 being the worst and 10 being the best life you can imagine. And they all dropped in terms of their reports of their own well-being, except in Vietnam. That's the only country where it didn't. And in Peru, we saw the biggest drops, and we saw a lot of problems with families who had a lot of cases of COVID, and stress and worry about catching the disease, or if your parents are going to catch the disease. So let me just turn to a few aspects of the findings. There are a lot, but I thought I'd focus on education, work, and mental health. and tried to speak about resilience. It's a mixed picture, to be honest. There's some resilience, but there's also growing inequality in the different countries. So for many students, as I mentioned, it's just been almost impossible for students who don't have access to the internet or a device to learn on. There are two factors: you need internet and you also need a device. So in Ethiopia, of those who were enrolled, almost 40% of the girls hadn't engaged in any form of learning almost in the full year. And in India, it was about 15%. Actually, in Peru, we saw that boys were more at risk of dropping out. And in Vietnam, we didn't really see dropout because schools had gone back. If someone has dropped out of school or education, it was because they'd finished high school and decided not to continue their education. So there are big challenges, I think, for kids who've really been out of school for a full year with no online learning. And as a project, we're trying to advocate for more access to schooling for those who've had trouble attending or getting online. At 19 and 26, a lot of these young people have been working for a long time. A lot of them have been working since they were 6 or 7 years old. At 26, some of them are not working because they're full-time parents, a lot of the women. And at 19, there's a combination of people in school and people in work. And again, just to make a bit of a comparison, in Ethiopia, of the kids who are in school, 45% of them are still in primary school. So they are still trying to complete just their basic education at the moment. And here we do have a little bit of a story of resilience, I think. We definitely saw a severe economic shock between February, March, and then the first call we made in August, June and then August. We saw a lot of people who had a job before the pandemic had lost them, and those who did have a job and didn't lose it were not able to work from home. Also, we found that a lot of the 19-year-olds who were still in education did have to take other jobs to help the family, either paid work, but also helping out on the family business or farm. It did get better by the end of the year. By the time of the survey in November, December, we did see a bounce back in employment levels for most people in most of the countries, except for the older girls who didn't seem to get back into work if they dropped out. And we're investigating that. We think it may be around having kids. It may be around not finding the kind of job you've studied for if you've got a degree. We also see, as an element of the resilience, I think we saw a lot of flexibility and adaptability. If you've lost a job, moving into a different sector. So we see a big shift in the composition of where people work. Of course, much fewer worked in services, but more worked in agriculture. And if you think about it, agriculture is can be quite socially distanced if you're working out in a field. And also, most governments did not restrict agricultural activities the way that they may have closed retail down, for example. This slide's a bit of a roller coaster. After telling you about the resilience, it's true that now we look in April 2021, as I said, in Peru, COVID cases are rising. That's also true in India, and it is starting to be true in Ethiopia. But I think in Ethiopia, the big worry we've got is conflict in the north of Ethiopia. And in fact, we couldn't even complete our survey in the north of Ethiopia because there was a communication shutdown. So back to the resilience story, just to not be too depressing. Here's an example from Peru. So my chart here on the right is showing as a proportion of those who were already working before the pandemic in a particular sector, what proportion were working during the national lockdown. So the blue column shows the proportion working during the national lockdown. And in agriculture, you see it's 75% or so were able to keep working. Whereas when you look at construction, it was less than 20%, or 1 in 5 were able to work. In hospitality, only 1 in 5 were still able to go to work. So it dropped quite significantly in most sectors apart from agriculture. And then when we called back again in August, the national lockdown was just coming to an end in Peru, and we see a bounce back there quite strongly, up to almost 75% in manufacturing, in construction, not quite as much of a bounce back in retail hospitality, but still a bit of a bounce back, and then a further improvement by November, December. So in construction, we were above 80%, 85% or so of those who had been working in construction before the pandemic were working again towards the end. We also saw a higher skilled job bounce back, which is kind of encompassed in the other services here, which goes up to 80%. And we saw in terms of earnings that those who had higher levels of education and skills had bounced back quicker. So what impact has the pandemic had, this interruption to education, shifts in your activities that you've been doing? What impact has that had on mental health of young people? Well, in the August survey, we measured anxiety and depression, and we found almost half of the young women in Peru reported symptoms that were consistent with having at least mild anxiety, and almost the same in depression. And again, the huge contrast for us is between Vietnam and Peru, which had less than 10%, which is around the amount that you would find in a sort of non-crisis situation in many countries. But we did see an improvement by the time we interviewed again in December in all of the countries except Ethiopia. And we think that in Ethiopia, it's around the conflict why mental health has not improved as much as in the other countries. However, if you go back to those people who had reported running out of food during the pandemic, in all of the countries, even in Vietnam, those who were food insecure, running out of food, did report that they suffered higher symptoms of anxiety and depression. So young people are definitely suffering in all countries. And so we really recommend that there's a lot of focus on getting kids back into education, especially those who might have dropped out and had to take on more responsibilities for their family. So trying to get them back into the educational system, even though they might have dropped out and found it hard to get back in. I think that's important. And support for people who are really suffering from food insecurity, especially in the context of the UK government recently having made an announcement about cutting the budget for foreign assistance. I think that's going to hit a lot of families hard in the developing world. So there's an interview that I've done for Vox EU if you'd like to see more, or check the Young Lives website, which is based at the University of Oxford. And thank you for listening. And I look forward to talking more when you put your questions in the chat. Thank you.
Catherine, many thanks for a fascinating presentation. And that brings us to the end of the presentations.